everybody, this is Luke Gordon at Gordon Physical Therapy, and today I am in the yoga studio and we're shooting our first ever yoga video. So in just a minute I'm going to introduce our yoga instructor, Sandy Nolting, physical therapist here with Gordon Physical Therapy, and she does all of our yoga classes currently. And what we wanted to do is put together some instructional videos for people to do some of the yoga practices at home. So we're kind of intending these for two different audiences. The first audience is all the people that are already doing yoga with us. In case you want to do some of this stuff at home, you'll have a guided way to do some of the yoga exercises and activities. And then also, if you're on the fence about yoga or you're just interested in doing it at home for now, we're going to try to make it easy to follow and explain different ways to do yoga. So like I said, this is the first yoga video, and Sandy is going to cover what she calls breath awareness. And this is how all of her yoga students are starting each class. So whether you're in the most basic level yoga, which at Gordon PT we have what we call Welcome to Yoga for our brand new beginners, and then they transition into a really basic class called Breath Foundations. So whether you're in that class, which doesn't require a whole lot of mobility or anything like that, or you're in one of the higher level classes, which for us we go up to gentle yoga after that, and then we go to level 1 yoga. So regardless of any of those levels of difficulty, this is how Sandy's going to start each yoga session, again with a focus on the breath. So this is probably a 15-20 minute video, and then leading into the next video, which will be more about the actual movements and things like that. So I'm going to let Sandy take over here in just a moment, and she's going to start with seated breath awareness, and then she's also going to show you breath awareness from laying down. So depending on which level you're at or which one you're comfortable trying, she'll show you both ways, and I will let her take it from here. Here comes Sandy.
Thanks, Luke. Hi, I'm Sandy. So with breath awareness, it's the foundation for all yoga practice, and it's just a good, easy way to help you manage your health. I'm going to give you some introduction about your preparation for that. One is you want to make sure that the nasal passages are clear. So if you want to lightly blow your nose so that you feel a little bit more clear and ready to breathe, that will be good, because yoga is a practice of breathing in and out through the nostrils. Some other suggestions I might make, and this of course is based with your healthcare provider and you know what's right for you, but using a nasal rinse or a neti pot is not a bad practice, especially during cold season. Another option, I like to use essential oils if that's your comfort level and you have them around the house. You could take a drop of lavender or eucalyptus. I like to use a blend that's called Breathe, appropriately, from doTERRA essential oils. And if you put the oil in your hand, make sure your hands are clean before you bring them up to your face, of course, and then you warm it in your hands and then bring it in front, and then just cup so that you can take a breath in. It really helps to open things up. So again, it's a nice preparation for a breath awareness practice. I like to have people do it seated in my classes, making sure that you have an upright posture. So in the folding chair, you want to make sure that your hips are level with your knees, that you're able to sit upright, not slouched, that you're on the sitting bone so the pelvis is level and the feet are grounded. You'll see I have my feet on a blanket because my feet do not reach the floor. So that is always an option. For those that are more comfortable in lying down, or that they have such a busy mind that they need to be a little bit more grounded, let me show you what it would look like if you're lying down. I'm just going to move that chair out of the way. So simply on your floor, and you can do that right now, lying down, and if you need something for under your head, if your head tips back, I want to make sure that you're supported. Don't have too much height. It should be relatively level. I always suggest that people bend the knees and step the feet wide so the knees rock in and then they can be supported. Your legs can also be up on top of a couch or a chair, so you would look like in a tipped over chair with it. You can also lie on your side if that's easier for your back. I'm going to go back to the chair so that I can guide you through that. So make your selection right now. If you're more comfortable seated or lying down, and you won't need to see the screen at this point. You'll be closing your eyes so that you can hear my words. Before we do that, again, the breath should happen down in the abdominal region. We call it a diaphragm breath. So when you have your hand here, you should feel the rise of the belly when you breathe in through the nose, and you should feel the belly draw in, the sideways draw in. So we want to feel the breath down here, even though the lungs are in the upper chest. It's just an important element of this practice. I also want to remind those of you who've been in my class and those that are new to yoga that the breath is a tool that helps you balance your nervous system. So any feelings of stress or anxiety can be calmed with the breath awareness practice. If you have chronic pain issues, it's another way to bring some sense of ease with that. It's supportive for the digestive system and your immune system. So it's a good one to get introduced to and to practice regularly. So we'll begin. From your seated or lying down position, you're going to have your hands either beside you if you're lying down or supported on your lap. I'm going to ask that you bring your chin down a little bit towards the chest, and that you, if you're not comfortable closing your eyes, that you just direct your gaze down in front of you with a very soft gaze, or closing your eyes. I'll be closing my eyes. So we start the process understanding that first, that we are in a supported position. We can let go of the muscular effort right now. You'll draw your attention to that inhalation. As it enters the nasal passages, it has a temperature to it. You'll feel the coolness of that breath. As you exhale, again noticing the temperature, the breath feels neutral or maybe slightly warm as it leaves the nasal passages. With each inhalation, follow the path of that breath, the movement associated with it. As you take the breath in, you'll notice that there is movement in the abdominal region, and the breath rises up towards the collarbones. And from the fullness of each inhalation, you'll release. And with the exhale, you soften from the collarbones, the upper chest, and then a sense of emptiness, stillness in the abdominal region at the end of the breath before the next inhale begins. So I'll continue to guide you with this breath, bringing your attention to the qualities, the sensation of your breath, and the path of the breath. Again, as you take the inhale into the body, it's like pouring water into a container. It fills from the bottom. So noticing the rise of the belly, expansion through the sideways, the rib cage, and the sense of fullness with each breath in. With each breath out, it's like pouring water out of that container. It empties from the top. So the rib cage begins to soften and draw inward. The belly, sideways, draw inward. And that sense of emptiness, pause and stillness. Notice those transitions with each breath. From the fullness of the breath when your exhale begins, and from the emptiness of the breath when your next inhale begins. If in the cycle of the breath your mind wanders, whether it be sounds inside your room or outside of your home that you're watching from, or it can be just the chatter within your own mind, thoughts, awarenesses. If you become distracted by those, Just notice that, and in the noticing, come back to this following, this attention and observation of your breath. Your breath will find its rhythm. There's no need to force it. Just give it time to move through the cycle. You can imagine that your breath is scanning the interior body. It's a way to help cleanse the interior, to help balance the function of all of the systems. Giving permission for your exhalation to lengthen. Stay for just a moment, a count or two in that pause at the end of the breath. And let's sit quietly for just a moment more, about 4 breath cycles. You'll hear me signal with a chime. Chime in yoga is simply to help you to recognize this moment now. You can keep your eyes closed and just taking in that information of what you feel like presently. State of mind within your body and your awareness now of your breath. We close this segment of breath awareness. I generally invite people to bring palms together at their heart. Again, honoring yourself and your inner wisdom from this time that you spent, this little gift to yourself of slowing down, being present, letting the breath synchronize and balance the systems. You can open your eyes. Bring your hands back to your thighs. Gently open your eyes if they have not opened yet. And when we open our eyes at the end of a practice, it's acknowledgement. We've taken some time. Maybe we've sensed a quieting of the heart rate, quieting of the thought patterns, just a little bit more at ease in ourselves. That's what we take into our practice. If you'd like to continue with me, as Luke said, there is a movement part to yoga, and I begin gently, and this is called a joint freeing series. If you feel the breath awareness practice is enough, then thank you for joining me for that part. The joint freeing series I do in the chair. There is an option of lying down, and we'll do that in another video along with some other gentle movements, but for now we'll be in the chair. I'm going to move my blanket, and I'm going to scoot forward on my chair just a bit so I can be at the edge. So in yoga, we call this, and for those who've been with me, you know, the sitting bones, right? You feel those on the base of the chair. You feel the pelvis being level. It's not rocked back. It's not tipped forward. You're not slouched. So we try to bring the spine upright, balancing the weight of the head above the pelvis. The shoulders are broad. And we begin with moving the head. And I'm going to be giving you the breath cues for this. And you might feel it's a little out of sync or not coordinated. So just be aware of that. There is a reason for the direction I'm giving you, because it's the way the body has put that breathing mechanism in place for us, the attachment of the muscles and how things move. So starting with the head, we're going to be inhaling and coming back to center. And then I'm going to have you notice, because the cue is going to be exhaling. Now, the breath police will not show up if you do this an opposite, but it's a little bit easier if we exhale. And you might notice the difference with that. And inhale back to center. Then we'll exhale and inhale. Now, you're going to go through your breath rate. I'm going to still do the motion as I'm talking. This would be your breath out. This will be your breath in. You're going to move the length of your breath, breathing in back to center. If your breath is short, your movement's going to be a little quicker than what mine will be. Breath in, back, and typically we go maybe 6 or 8 breath cycles with each of these. Inhaling back, noticing the differences between moving right and left, because they're not necessarily the same. There might be some restriction because of arthritis or injury. Be respectful of that. Inhaling back to center and pause. The next movement is going to be a side bending. When we side bend, you're going to feel that stretch on this side of the neck. You'll inhale back up and exhale. The exhale, the ribs are coming down, the belly is scooping inward. The inhale, everything inflates. It brings you back into upright and alignment. Exhaling as you side tip. Inhale, coming up to center. Again, try not to move more than just your neck. Keep the shoulders, the spine still. Inhaling back up. And one more time each side. Exhaling, inhaling. Again, try your best in and out through the nose. Exhaling, inhaling back to center. And then we're going to lengthen the back of the neck by bringing the chin down towards the chest. Try not to round the spine. We're going to be getting there. Inhaling up to center. You can gently look up, but again, don't strain those structures within the vertebrae. Listen to your body. We are trying to reset habits that might not be serving you with this very subtle and guided practice. Inhaling up, exhaling down through the range that your body can comfortably do. In yoga, we call this effortless effort. One more time, either looking up or back, and then exhale, looking down. Feel the stretch on the back of the neck. Inhale back up to center. We're going to move down to the shoulders. We'll use the arms as part of that process. Inhale with your arms supported on your lap. The palms are up. If there are no restrictions in your shoulder, you can have your arms down beside you. Either is acceptable. Exhaling when the arms come up to the shoulders, and inhaling down. Be respectful of any arthritis within the fingers, so you don't need to make a soft fist, but you can if that's comfortable for you. But just work on inhaling and exhaling. Breath in. Breath out. Again, moving your pace, the length of your breath. One more time. Breath in. Breath out, and keep your hands up either with a light fist or just hands open, and we're going to lift the elbows, inhaling and exhaling. Breath in, breath out. We're helping that rib cage as well as the shoulder girdle. Breath in, breath out. If the arms aren't restricted, you can bring yourself up a little higher. You can be in this pattern up here, and I'm going to give an option of exhaling and inhaling. So it's just a little bit bigger. Again, everything in yoga is modifiable. We can grade the motion, and the important piece is pairing it. Exhale with this drawing in motion, and inhale coming out. Let's let the arms come down if you did raise them. Take a breath in here. Exhale, give yourself a hug, and it can be a low hug. Again, shoulder, neck pain, we don't want to disturb that. Inhale coming up. And if you feel more comfortable, you can raise them. It can be a hug, exhaling, inhaling. You'll notice I'm alternating. This might be a coordination issue, so hang in there. Don't be flustered. Exhaling, inhaling, exhaling. So you notice we're trying to go long, slow breaths. I don't count repetitions. It's not a gym workout. It's a body awareness practice. One more time, inhaling and coming back down. You're going to bring your shoulders up, back, and around. So if you think about taking a breath in and a breath out, and a breath in and a breath out. Good. And then make a light fist and open up wide. Breath in, breath out, breath in, breath out. You might want to shake just to kind of get rid of any tension that you've carried. We're going to come down to the spine now. So you notice we've done the neck, we've done the shoulders, the elbows, the hands. The hands are support on your thighs right now. We're going to do some pelvic and spine patterns. So I'm tipping back on the sitting bones, which makes my spine round. And then when I tip forward on the sitting bones, it brings my spine upright and tall. So when I tip backwards, let the breath out through the nose. When you tip forward, take the breath in. So again, this is called cat-cow in yoga. I don't have to be down on the floor to do that pose because it is a rock of the pelvis and this wave of action through each vertebrae of the spine. Exhaling and inhaling. Breath out. Breath in. Breath out. Move the length of your breath. You might be going a little quicker with me than I am, or a little shorter. And inhaling, coming back up to center. We'll do a twist now. You're going to leave one hand forward and draw the other one back as if you're bringing your hand towards your pocket. You'll notice the belly button turns. And if I pause here, I'm not trying to do motion through my neck. So don't overturn with the head. We deceive ourselves sometimes by making it a bigger or harder motion than what it needs to be. We're trying to go at the subtle level, a gentle ringing action through the spine. I'm going to have you breathe here rather than with a movement pattern right now. Breathing in and out, noticing movement of the rib cage. On your exhale, draw the belly inward, a scooping action in order to really bring the ribs down and to help empty the breath. This ringing action is nourishing for the interior. It helps to kind of get rid of those cellular waste products that our body is dispensing. So ringing helps. And then after your exhalation, inhale back to center, and that helps the system just take in that new oxygen and it circulates in our system. It helps with the delivery of nutrients. We're going to go the other side, keeping other hand forward, and the other one comes towards your pocket. The belly is what's twisting. It's a ringing action around your spine. You're staying upright. You're still weighted on the sitting bones. Feet are on the floor. Following your breath, noticing the expansion that happens through the rib cage on the inhalation, and the drawing in and down with that exhalation. And from your next exhalation, take your inhale, come back to center. We're going to go one more movement pattern with this segment here, and it's a side bending. If you bring your hand to the side of your chair, it'll help give you support. We always call in yoga rooting or grounding. So I don't want to just do a free-for-all side bending. I want to measure it. So I want to keep myself anchored here. If you're able to comfortably bring your other arm up, inhaling, then I'm going to exhale to that side where my hand is on the seat of the chair. I'm going to inhale back up, and I'm going to exhale. I'm going to put that hand down beside me, inhale the other arm up, and exhale. Opening the side ribs, a gentle bend of the spine, inhaling up and exhaling down. Now you can continue with the arm. I'm going to take it out of the picture so that you don't feel the need to. I just inhale. This would be your arm raising if you choose to continue to do that. And I'm exhaling. So notice I can still get opening of the rib. Inhale back upright, ground with this hand, and exhale. side bending. I'm not trying to overdo with my head. I'm trying to concentrate that motion through each segment of the spine. The exhale is my bending. It helps to bring these ribs in, expand these on my inhale as I come up. And one more time, exhaling and inhaling up. We're going to move down now to the hips, the knees, the feet. And you can try this. If this is comfortable, you can bring your knee up towards you. If it's not, then leave your foot down and just raise your foot, your heel up from the floor. So I'll lead it first with my breath in. My breath out is either knee up towards me, inhale down. If you can't raise it, then just exhale, lift your heel up. Okay, so either one of those patterns. Inhale, no movement. Exhale when I'm shortening those muscle fibers and inhaling down. If you're moving the knee, it would be an exhale here and coming back down. We're going to go other side, inhaling, again, maybe just lifting heel, exhaling, inhaling that foot flat. This would be the option, drawing knee up, exhaling with a squeeze, inhaling down. We'll do the same side, exhaling, either lifting heel, inhaling feet flat, or exhaling knee up to chest. We'll go one more time with whichever pattern you've chosen for yourself. Inhaling it down and exhaling, either heel or lifting knee, and bringing it back down. And now, if you're still comfortable, now I've asked that you sit forward on your chair. If your back is getting tired, if you feel like you're fatiguing, you can scoot back to have the support of your seat back to give you that little bit of extra ease for the abdominal muscles. Bringing the leg out so that you're in that position where the hamstring isn't giving you too much grief. So it can be bent knee, it can be straight leg, as long as your pelvis hasn't tipped and the spine rounded. So find that position with that. To get a little extra awareness of the back of my leg, then I'm going to hinge at the hip crease. Notice I don't round my spine. And when I come forward, I notice where I get that sensation of stretch or length on the back of my thigh, maybe into my calf. It'll be different if the toes are pointed versus the ankle being flexed. Breathe here for a couple cycles. And then coming back upright, inhaling, and we're going to move just at the foot. So I'm going to point my foot, taking a breath in, exhaling, I'm going to flex and bring the toes up towards me. Inhaling as you point, the breath moves the length of the motion. When it transitions, you change the direction of movement, exhaling. Inhale, pointing, exhale, flexing. Let's go one more time. Breath in and breath out. You can take your foot a little side to side. Notice if you have to use all of the leg to do that, if you can isolate it to the ankle. I exhale when I draw it in. I inhale when I sweep it outward. Exhaling and inhaling. And before we leave the side, take a little ankle circle, inhaling as it comes down towards the floor, exhaling as the toes come up towards you. Inhaling, exhaling, and switch directions. Inhaling, exhaling, breath in, breath out, and one more time through. Breath in, breath out. Bringing that foot back, you might start to notice, and you can see, I think in frame here, difference of color in my feet. Maybe that shows up on the video, and you'll notice that for yourself. Just by this ease of movement, we're improving the circulation with that. So we'll do the second side, bringing that leg out. Again, knee can be bent or leg straight based on the length of your hamstring without challenging your posture of pelvis and spine. And if I hinge at the hip crease, I'm going forward slightly to that place where the back of my leg is talking to me. I'm not trying to go for a preconceived target where I think I should be. I'm really listening to my body, understanding the balance of muscle length in all of these body segments so that they work together and I'm not straining or holding my breath. It should move through my system in any position that I'm in. After 2, 3, or 4 breath cycles, coming back upright so that you can more freely move the foot, inhaling on the point, exhaling on the flex. When we go through patterns like this, we call it flossing the nerve tissue or flossing the connective tissue. It's these long, slow movements, and it's not just isolated to what's happening at the foot. It's really the connection of that tissue all the way up to the sitting bones. It's getting a glide, and if we can create slide and glide of these connective tissue layers, we bring a better level of health to ourselves. So inhaling on the point, exhaling on the flex, and then sweeping inward. Inhaling, sweeping out. Exhaling. Now your range of motion may be different. Don't try to compare. Yoga is about letting go of ego and just being curious what each foot is able to do, one compared to the other, not comparing to somebody else. Finish with some circling, inhaling, exhaling. Can you isolate this motion relatively to the ankle foot rather than trying to steer it with the whole leg, the rest of the body? And then changing directions, your inhale sweeping downwards, your exhale drawing up. Yoga is usually a practice of being barefoot, but you can keep socks on if your feet are cold. We just don't do a practice when our socks are on when we're standing with it. And bringing that leg back, and let's try a little Baddha Konasana, cobbler pose, soles of feet together, and the knees and the hips can open out. We're trying to give them a little bit of a length on the inner thigh and some lubrication at the hip joints itself. You could go back to doing a cat-cow motion of rocking on the back of the sitting bones, exhaling and inhaling, coming upright. Exhaling, pelvis tips back, spine follows, gentle with the head and shoulders. Inhaling. Again, really understand that that breath is cleansing. It's moving through you. It's helping to integrate motion and integrate body, mind, and breath. It brings us into balance to all the systems. We'll come back up, and we're going to finish with a pose that's called child's pose. The legs are wide on your chair. You're going to bring your weight to the back of your sitting bones, so I'm rounding here a little bit. I'm going to bring my elbows to my knees, let my hands relax, and my head is just going to be soft here. You'll notice, hopefully, and sense in your own body that the spine is rounded. Be aware if you have pain, if this is uncomfortable for you, then just come back up to sitting and let your back be supported in the chair that you're on. If this isn't causing any pain, continue to be here breathing. I'm not taking you any lower. There are precautions related to glaucoma and blood pressure, so this is enough to get the benefits of the pose. But notice how your breath changes, how your inhalation expands your rib cage. In the exhale, the ribs draw in and down, the belly draws up and in. The inhale expands. It's like the breath is pushing from the inside out. Let it have the time to do that action. Let your exhale come to that place of feeling empty. Pausing there. Let's do 2 more breaths. When we come up, don't lift up abruptly and don't lead with the head. Bring your hands to the top of your knees. Keep your head down. Push into the floor with the soles of your feet, hands to knees. Inhale. You'll first raise up through the spine and the head comes up last. Exhaling, bring your legs back in, and if you're still forward on your chair, sit back. This is where we would close a practice again with a little shavasana or breath awareness, which I won't lead you through this time. The next segments that we'll film will be a standing practice and a relaxation practice, a stress reduction. So thank you for joining me, and as we say in yoga, palms together, I honor the light in you. Namaste.